Hello, my name is Sukti Bains and I'm one of the student of DNP program. So almost done with my program. So I just finished in my clinical hours. So we're gonna just talk about how was the experience and everything. I was really thanks to my school, to my teachers, and of course my preceptor too, who helped me to just completing my hours. It was a really good experience with her, for because for the best experience for this, the preceptor is really flexible. It was not like rigid to something. And only the worst part, like with the words, sometimes the preceptor is kind of available all the days, kind of Saturdays, Sundays, sometime, but we are not able to because of schools not open on that days. So I mean, otherwise this experience is good with the preceptors. So I work with the two preceptors. One is psychologist Dr. Kendall, and another one is Dr. Nawanko, Dr. Shadima Nawanko. So she's a psychiatrist, nurse practitioner. So I have a good experience with the both of preceptors. Dr. Kendall is like more psychologist, and like we before that, I don't know what is the difference between and how they are jumping from one therapy to another therapy. But since I work with her, I understand how they are utilizing the different psychotherapies. That was a good experience with her. And Dr. Nawanko is also, we work, she working with the more things actually, kind of psychotherapies, as well as the more is medication management. So I really learn a good more from Dr. Nawanko, definitely, because she is giving us all explanations for everything, medications, disease management, and yeah, it's a good experience with Dr. Nawanko. So we have, because this is, everything is online, most of them is online, and kind of I want to do in person too. But the good thing, I was working in psych department before that, so that was a good, kind of helpful, because whenever I see the patients related to that, and I'm able to correlate with this kind of disease, symptoms and all that stuff. But only I think I like to be doing person too, but because of some circumstances I'm not able to find preceptors. But it was like good learning through online too. For this one, so like the developmental, symbolic way, I was feeling, if we just do the early detection, most of the patients which I notice, they come on their kind of, you know when it's already worse. So I believe, it's very important to just educate the community, even through different camps and everything, to early detections of the problems. And like ADHD, I know the patient, the most of the people now, even especially after the COVID, like I noticed like a lot of people dealing with ADHD. But I believe if the medication is not only the way, I think the psychotherapy is the best way to deal, if we can just early detections of the problem. So I feel, that's the good thing. And another thing, with Dr. Shadima Nawanko, so she was really good actually. She's more engaged actually. Whenever we have a free time during our clinical hours, so she always like get any topic, any of the psychiatric topics. So she was teaching on that, telling us the difference, clearing our doubts. So it's not like if we don't have a patient, so we are just sitting down. No, so she was always giving us scenarios. She's always like putting the case studies, so we can learn more about the patients, and then how is easy. So I think it's she's really good to doing all these stuff. And yes, I definitely recommend Dr. Novenko, because she helping her students a lot. uh, yeah, so she's not only, not only with the medication management and all that stuff, she's also guiding us with, like, which is good to review, good for your in future life, like that stuff. So I think it's she's good with that. So I definitely recommend for that the students too. So and so with the so I really wish to be able, the kind of the targeting, kind of the diagnosis. I think it was very hard to find a diagnosis. I was always feeling with other medical diagnosis easy. We can just do a test, like physical or any other test. And I believe the psychiatric diagnosis is not easy. It's really not easy to, and I believe them, and the treatment plan is also, I think it's really hard. You just like, kind of putting yourself always in danger. I believe it because it's not easy to do with the dealing with the patient and making a diagnosis and treatment plan. Definitely I was really going to work on these ones in my, in my futures and all that stuff actually. um, so that facility actually, the Dr. Navanko, she was usually, I think, 2 3 days she's working from home. So where she's and then 2 days I think she was in the clinic. So where she, like, in person patients come and then she's able to see. The preceptor is so good with the patients too. Very, I can say the interpersonal relationship is really good with them. So the patients really like her, and her style is not like, putting somebody in kind of embarrassment, like, he had something, and very genuine and very nice way. Most the kids, I noticed, the kids are like very frankly with her, and then they listening. I mean, I like it, like they're listening. When the next time parents, they said, yeah, we already, it's improved. So I really like the way, the style she did it. So overall my experience with the patient, so we are not allowed to, just deal the patient directly, but we are able to do, you know just watching and just do discussion after visit with the doctor, because doctor asking us the questions regarding that patients, and we are able to, more kind of, when the doctor tell the history, this even same thing with the Dr. Kendall too. They also like telling the story after that this was happened, and then they asking questions like, what's your opinion? So that was, I think it's good with that. Yeah, definitely. I really want to be a psychiatric nurse, even not like right now. Since like I was in my nursing, I want to be psychiatric specialty, because I feel this is hard. This is not the easy job. Everybody think, oh, it's easy. No, but not. I feel not. It's not. So I definitely wants to be a nurse practitioner. So yeah, as I told, we are not able to see alone patient, but hopefully in future we will. I will try my best. Um, so yeah, so doctor is always, good with doing discussions and discussion with us after visit. So explanation more if you have any doubts, if you have any questions, and the doctor trying to be digging more in with us, and getting our knowledge too. So we learn really good with that. For business aspect, I also think it's really good business, because you don't have to be go. I mean, I like to be work from home, but you don't have to be go like anywhere. And the more is kind of the telepsych right now. It's really good, because I noticing the doctor is watching a lot of patient, even staying in home. You can watch your kids. I like that one, but I really want to go in person facility, because for learning purposes, no, but definitely from long term, it's just really good to go, business versus. Yes, and another thing with this doctor, I learning a coding and billings too, because before that I don't really understand like what's up, coding, and then why they are so. And then I find out, okay, why is the coding is important, because of, the Medicare, medical, they want me the codings to pay for us. So I think it's good. um, I feel like changes, yes, definitely, because the way of thinking is totally different right now. Before that, I was not like thinking as a kind of the doctor level, but now whenever I'm reading something, not only from, anywhere, I was like reading and I was like trying to be get the knowledge, so which I can utilize for my patients. So I'm really excited, like whenever I'm going real in real words too, but I'm a little scared too, but hopefully it's gonna be good when I'm just passing through my whole degree. And yeah, so yeah, and everything, the preceptors is she was really work hard. She was like, I was so, I was like really surprised, like she's seeing 10, 11 patients one day. And but I think she's really work hard. She's even encouraging us to do everything. uh, I feel different in me actually, because I don't want to be put everything on everybody. So that's why I was telling, like, I want to be doing the diagnosis as soon as possible, so we can because most of the kids on medication, I feel so bad for that. And because I know once you start on medication in your early ages, it's very hard to be, it's very hard to just take off from this one. So I want to be trying to be do more educations for the kids. And also so just want to change. I really want to change myself to not to be rushed. Sometimes I'm really rushing. I learned from Dr. Novanko, very calm. So I just wanna change that thing in me. uh, and yeah, definitely the patients are really good. I some of them, the patients, I was like, when I was listening, I was trying to be getting when they have a next appointment. So I really wanna, yeah, if I in future, if I got that patients, definitely I wanna work with them. So as I told, like, probably they don't know us, but we know them. So yeah, it was really good. All over, it was a really good experience with my clinicals. I learned a lot. I really thanks to my university too. My teachers, my faculty was really really helpful. Dr. Will, Dr. Christie, they're really really helpful. I'm really thank you to everybody. Thank you.